I think our third presentation is by Dr. Vladimir Nikitović. He's the head of the Center for Demographic Research at the National Institute of Social Sciences. And we sort of cap that up, and then I'll invite our discussants to comment as well. Thank you.
Okay. Sorry. Thank you so much. I'm really grateful to be here today with you, despite the effects of jet lag still feeling. To go in medias res directly because of time limit, I do personally very much like the philosophical vibe, as someone said at the previous session. But now I have to get back to the data-driven insights, which I usually do in my research. As you noticed, I come from Serbia. It's a small country from southeastern Europe, precisely the Balkans. We were known very well as the troublemakers during the 1990s in terms of wars and their negative implications, both developmentally and demographically, but hopefully not anymore. But you never know with this region, of course. Anyway, Serbia was among the forerunners of population aging in Europe. Not so much for the increasing lifespans, like in this region, for example, or other most developed countries in Europe, but more for the very early onset of below replacement fertility due to somewhat specific reasons of that part of Europe. Maybe that's why it would be interesting to share with you briefly some of the most important insights regarding the establishing and conducting NTAs in Serbia, along with some key policy implications. I'm not completing. Oh, terrific. On this first slide, you can see the timeline of conducting NTA in Serbia, and as you can see, it started only recently. It was conducted by the National Statistical Agency, following, of course, the United Nations methodology, and soon after, a couple of policy brief recommendations resulted from these first sessions of this analysis. And currently, there is ongoing national time transfer counts for the first time. So today I will not be able to deliver any insights regarding this gender perspective, which would be quite interesting. And I can really expect something similar as we have seen at the first presentation regarding the unpaid work of women in India, I suppose. Okay, next slide. Doesn't. Okay. When it comes to practical application of NTA, which is some kind of focus of this session, the thing is, this analysis is already embedded in the key strategic documents, as you can see on the slide. Of course, from my point of view, not only mine and the other researchers in that region, frequent changes in the government structure should be the main issue in terms of it makes quite challenging to ensure that government partners remain really familiar not only with the methodology but also with the findings of this NTA analysis. That's why the UNFPA, as a main initiator of this analysis in the country, started to encourage broader stakeholder engagement to strengthen this cooperation with other key stakeholders in the country. So in terms of sustainability, as you can see, the key issue is that long-term sustainability, and I think it could be achieved if this analysis become a part of a regular statistical analysis and reports of the National Statistical Agency. And now just let's back to some of the key findings. I won't show all the slides, but as regards age profile of labor income, in Serbia, labor income grows significantly relatively late in the life cycle, peaking at the age of 41, It's quite earlier, for example, than in some more developed European countries. A lot of reasons. Maybe the most important is the activity rates that are typically lower than in these countries. And now just move back to two interesting graphs resulted from the NTA analysis in Serbia. As you can see, this is the age profile of total public and private consumption per capita by age in Serbia, and corresponding analysis in the EU 25, just for the sake of comparisons. And then, as you can see, consumption on child and youth in Serbia and on the oldest population is quite less socialist compared to the EU. We have private consumption dominating almost across the entire life cycle. It is typical difference comparing to the EU. For example, in the EU, you have a higher than private throughout the most of childhood, higher public spending, specifically in ages 3 to 16. And as you can see, total consumption in EU significantly increases at older ages due to higher public expenditures on health and long-term care, totally opposite to what we have in Serbia. And this is maybe the most typical slide from this NTA analysis, showing the life cycle deficit per capita in Serbia. And as you can see, maybe the first message, something corresponding to the previous presentation, this period in the life cycle with no deficit between consumption and labor income is relatively short. It's 31 years, somewhat shorter than in the EU. If I noticed well, it's even shorter than in Korea. But on the other hand, it's longer than in the most of the new EU member states, most countries of the former Eastern Bloc. Other interesting message from this site, if you look at closely, you will see that children and youth's deficit is funded primarily through private transfers, and that of older people through public transfers. And as you can see, old age deficits are mainly funded through public and private transfers when we talk about older people, but those private transfers dominantly consists of remittances from abroad, because we are very well known by the high diaspora. What is also interesting from this slide, if you compare it, there is no comparative figure here also, but comparing to the EU 25, private transfer there to the younger population are less prominent relative to the public ones, and also private transfer to the older population are almost non-existent. Deficits in older ages are covered from private savings to a considerably greater extent. In Serbia, it's almost non-existent when we talk about savings. It's typical difference. And now I'm just trying to summarize in the final slide some of the key recommendations based on these NTAs developed in Serbia in the last 4 to 5 years. There are 4 of them. It's more general in this for this presentation, and for sure there should be more funds allocated to develop preschool education in order to reduce those financial burden on the families caused by the expenditures on these purposes, of course. And of course, we found out that they should come primarily from the national budget, as they currently burden local authorities. Many of those local administrative units are really underdeveloped because of the high level of differences in that terms. The other message is it should be the coverage of children of preschool age should be increased, especially those of the youngest ages, because we are still lagging behind in that terms when we look at the children between 6 months of age and 3 years. And of course, to increase the coverage of children from the vulnerable groups, because there are a lot of studies showing that it's quite important for them to ensure them early learning and skill acquisition. It's for the overall good of society. And the third recommendations would be, in these terms of population aging, more funds need to be allocated for long-term care, which is quite low in Serbia, and the financial burden on these older persons need to be reduced, which is really shown from this NTA analysis. And finally, as you have seen on those two previous slides, the early reduction in the labor income, the short period in the life cycle with no consumption deficit, and the high share of public transfers for pensions, almost 40% in Serbia, and of course the predominant reliance on public transfers as a funding source in older ages. Probably measures need to be designed to effectively prolong the working lifespans, which we already heard a lot today. That will be all from my side at the moment. Thank you.